what I want to tell you right now, whether you are 10 years old, a high school student, a university student, whether you're a professional in the middle of your life, or whether you're older than that, it does not matter. Depression and most mental illnesses rob us of our self-esteem and our confidence. And that's the one thing that people don't often talk about, because everybody wants to think that, you want people to think that, hey, you know, I got everything under control. I'm cool. I'm not nervous. I'm this, I'm that. So we all walk around with this swagger. Very seldom do we hear people say, you know what? When I'm struggling, I do not believe in myself. Point number two, besides the fact that we lose self-esteem when we suffer from a mental health issue, we all do the same thing. We wear the mask. And it is so incredibly frightening when you realize that the people around you, the person that's sleeping beside you, the person that's down the hall, at your dinner table, wherever you are, that person is only showing you what that person wants you to see. So I could be up here on a bad day and you'd think, hey, what's that guy talking about with his mental health issue? Man, that guy doesn't seem to have that at all. He's not depressed. We wear the mask. We show you what we think you want to see. I have suffered from a mental health issue for 18 years. I've suffered from anxiety most of my life. But 18 years ago, I had a major fall into the hole that I would refer to as depression. That deep, dark hole, when you look up, you can't see anything. And you can't imagine any possibility that you could make it up there. To me, the hole was, if you look up at the ceiling, at the top there, could I climb up there? No. If you told me the only way I could survive was to go up there, I would think, I'm dead. And that's what I thought 18 years ago. I thought I was dead. I thought my life was over. Because in a lot of ways, my life was over. Because a day spent severely depressed is no better than a day that you are dead. The only difference is that you can come back from a bad day. So 18 years ago, I get hit by this thing. But it doesn't hit me like bam, like that. Depression is more the cumulative effect of little changes. So for me, it was like a little tap on the arm that I didn't even know was happening. A little tap on the arm. And if you do this enough times, you will bruise yourself. And after a couple of days of doing this, it'll start to hurt. I mean, it's not really realistic. I mean, you'd have to have other problems going on if you're doing this for 2 straight days. But the point is, you don't notice one tap, but you notice 1,000 taps. It's like you're in the bath, and the water is warm, and it feels good. And you think, wow, the water's warm. It feels good. I'm not a bath guy, by the way, just so you know. I'm not. So I don't want to be perceived as being a bath guy, but I have taken baths before. And the water, all of a sudden, you feel it, and you think, it's kind of cool. What happened? You didn't notice it changing. You noticed the cumulative effect of tiny, tiny changes. And that is depression. One day I woke up and said, oh my gosh, I'm thinking back. What happened to me? The person I was is gone. The person I am, I don't want to be. That's what depression did to me. It took me, Michael, and replaced me with me, Michael. And I hated that person. I hated that person because that person could experience no joy. That person had no belief in himself. That person, all the things that Michael wanted to be, wanted to do with his life, that person couldn't be. And that is at the heart of mental health issues. That is at the heart of depression. It robs you of who you are and replaces you with someone else. And the worst thing about it is, it makes you feel like it's your fault. So now you've fallen into this hole. And I'm in this hole and I'm looking up and I'm thinking, how the hell am I going to get out of this hole? There's no way I can climb up there. And worst of all, this is my fault. I put myself into this hole. And even worse than that, it's my fault that I can't climb up. That's what depression is. It's this feeling of being totally lost, having lost yourself and blaming yourself for it. So, my name is Michael Landsberg. I suffer from a mental health issue, depression, anxiety. You could throw a couple others on, but for me it's mostly depression with a little bit of anxiety. I have suffered this for 18 years. I am on medication today. I will be on medication tomorrow, and I will be on medication the rest of my life. Those are words that you seldom hear people say in front of a crowd. And that is one of the reasons why I want to be here tonight. Because I want to say it. I want to say it a few times. I want to show you that I'm not ashamed. I'm not embarrassed. I am not weak. And if we as a society could believe that, If everyone thought, mental health issues are exactly like physical issues, like the difference between Parkinson's and depression is we call Parkinson's a brain disease, and we call depression a mental illness. Why is that? I got a buddy, he lives in Niagara Falls, Steve Lutzing, played in the NHL, coached the Tampa Bay Lightning. He has Parkinson's. He has a brain disease, but I got a mental illness. I want a brain disease. I don't want a mental illness because you don't know what a mental illness is. I don't know what a mental illness is. So I think as a world, as a society, if we could all do simply this: I have this thing, I'm not ashamed of it, I'm not embarrassed by it, and you know what? I'm kind of proud of the fact that I'm willing to get up here and tell you about that. If we could do that, then we would all go for help. Then we would all get out of the hole, or at least we would have the best possibility of getting out of the hole. How many of you struggle with a mental health issue like I'm taught? Whoa, that was like, people usually this is the way it is. Hands up, like really slowly, like looking around. So let me ask you again, how many of you struggle with a mental health issue like I do? Well, this is the most honest room that I've ever been in front of, and it does my heart good. All I want from people who say, hey, what can I do for you, Michael? I know that at times you have really struggled. What can I do when you're in that position? Really what I want is I just want you to say, I don't understand what that's like, and therefore I won't propose to understand, and I won't make suggestions based on my own reality. That, for me, when people say, as a caregiver, what can I give to someone who's struggling? That's the biggest thing, is the understanding that we don't speak the same language, and there is a barrier that exists between us that will never come down. How many of you either suffer from or care about someone who suffers from a mental health issue? Pretty much everybody in the room. What other health issue would there be that would be that widespread, that would still be under the table, that we would still as a society know that more than half the people that suffer from the illness that I suffer from and many of you suffer from will never tell anyone about it, will not go for help, will not share with their family, they will live in pain and suffer. My words to you are, fight for your happiness. Brain disease, thank you. Brain disease is not often easily treated. Let me tell you the story of how my life got changed, because it was 2008. I had my last fall into this really deep, dark hole of depression. And I can remember being in the Marriott Hotel, room 521, sitting on the edge of the bed at 4 a.m. in the morning and thinking, I am in so much pain that I don't want to live. Now, there's a difference. I was not contemplating taking my own life because I'd been through this before. I had suffered that deeply and had been brought back. Now, I lost confidence that I'd be brought back, which is part of the illness. You always think, well, this time it's not going to help, or I'm going to be one of the ones that won't. It makes you very pessimistic. But I remember sitting on the edge of the bed thinking, this pain is terrible. But I never talked about it publicly. Everybody in my life knew. My family knew, my friends knew, people at work knew, but I never talked about it on TV. I never used the platforms that I have to be able to talk about it. And in 2009, we had a guest on the show who was a former Montreal Canadian. Anyone familiar with the name Stéphane Richer? So Stéphane Richer was a guest on Off the Record. I'd never met him before. We had a chat outside our green room. I said, look, Stéphane, I've never met you before. You don't owe me anything. But I know that in the 1990s, you suffered from depression. And I'd like to ask you, if you're okay, how you're doing. And he thought about it. And I'm going to pause now, because this pause and this whole scenario changed my life. I said to him, well, if it make you more comfortable, when I ask you, I'll share with the fact that I too have struggled. Okay, we went on the air, we talked for maybe 90 seconds tops. Maybe it was less than that. The next day, I start getting emails. And the emails say essentially the same thing. Michael, I'm going to tell you something I've never told anyone before. I've been suffering from depression or anxiety or undiagnosed something for 6 months or a year or 5 years or 10 years. And one person sent me this message that said, I've suffered all my life, and my dad suffered all his life but never told anyone. But I'm telling you because I saw you on television talking about your own struggles. And you didn't seem ashamed, and Stéphane Richer was talking about his problems. He didn't seem embarrassed, and he sure as hell didn't seem weak. So now I have the confidence to share this with you.
So I have a number of different roles in my life. I am a family doctor, as Michael mentioned. I'm a family doctor to my patients. So if you're not my patient, just call me Doug. I'm also a father to my children. I'm a husband. I'm a friend. I'm a son. I am a brother. I'm an uncle. A lot of different things, right? And in each of those roles, I can promise you that I've had failures and I've had successes, as all of you probably have in a number of different roles in your lives. And the one consistent thing I will say, in the brighter moments, whether they're attached to a success or a failure, is they always had something to do with me acknowledging that I didn't have all the answers, that I needed help. So if you're an older adult living with a mental illness in our society, you've got two problems, according to societal norms. You're aging and you have a mental health issue. And you are susceptible to a large degree of discrimination and stigma for those two reasons. People may act differently towards you. They may speak differently to you. They may project the idea that you are less whole than me because you're older. You're less whole than me because you have a mental illness. Somehow you're damaged. I'm going to challenge that thought related to aging. Being older somehow means you're less capable. That is categorically false. And here's the proof. I'm 44 years old. If you're in this audience and you're 84, you've lived on this planet 4 decades longer than I have. You've acquired more knowledge and more wisdom than I have had an opportunity to acquire. You've made more relationships. You've had more successes and more failures in your life than I've had a chance to be touched by. And somehow you're less whole than me. That's an odd way to think about aging. 70% of adults that are living with mental illness today say that they had symptoms before the age of 18 and they didn't tell anybody about it. We heard a story about that tonight. And interestingly, 40% of the parents of those adolescents say that they would never, under any circumstances, tell anyone in their life, including their own doctor, that their child was suffering from a mental illness for fear that they'd be stigmatized against. So we've got to do better. And so as a healthcare provider, the best way, or the only way I know how to start, and what I would promote to any healthcare provider in the audience tonight, we can battle our own projected discrimination by putting the person ahead of the illness. Make a connection with the person behind the diagnosis. Do your best to find out who that person is. I said I would talk about depression, anxiety, and aging. Those are 3 words. One of them is a diagnosis. One of them is a symptom until properly categorized, and I'll explain that. And one of them is a success, and I'm going to start with a success. In Canada, aging is a success. Aging is not a disease. Stop talking about getting old like it's something we need to treat. Any country in the world would give almost anything to have an average life expectancy of 82 years and a quality of life like we have in Canada. When I hear phrases like, what are we going to do about this aging crisis? It makes me want to pull my hair out. This is not a crisis. This is a victory. Yes, there are problems with the system. There are challenges that we acquire as we get older. But the language we use, talking about a white wave and a silver tsunami coming, like this whole cohort of aging baby boomers is somehow a huge problem that we just have to deal with. No, these are the people that have contributed most to our society. Aging is a success, and it's part of our cultural identity as Canadians that we should be most proud of. I know Suzanne Labarge was not able to be here tonight, but it is because of people like her, not just her generous gifts, but through her vision, that we're able to realize the promise of a society that truly values its older adult citizens. I think the work she is doing and the projects she is helping to coordinate are just unbelievable and really deserve our respect. A lot of people think that depression is an inevitable part of growing older. That is no, with capital letters, bold, underlined, 4 exclamation marks at the end. Depression is not an inevitable part of aging. They do not have to go hand in hand. 5 to 10% of older adults living in our communities, yes, do have depression. And that's a big number, and we need to have a system in place that can support them. But that means that the majority of older adults living in our society do not have depression. So when you see it as a friend or a healthcare provider, it is not normal, and it needs some attention, or it could benefit from that. What factors increase our risk of depression as we get older? Well, one of them is social isolation. That's a big one. Social isolation is an independent risk factor for major depression as we age. And that's important to think about, right? As a family physician, that's important for me to reflect on. But it's far more important that I know you have somebody in your life that loves you than I know what your blood pressure is. Another big factor risk for major depression as we get a little older are the accumulation of medical conditions. So if I've had a chronic disease like diabetes or cancer, heart disease, if I've had a stroke before, these are all things that are going to exponentially increase my risk of depression. So be on the lookout. And interestingly, cure rates exceed 80%. So what's the relevance of identifying people who are suffering with depression in older adult years is that there's treatment available. And it may involve physical activity and nutrition, medication, it may involve individual or group counseling, mindfulness-based stress reduction, yoga. There are all kinds of different treatment options that might suit you and suit your individual needs, and we can't access them if we can't find you. Why is it so hard for me to pick up in my office? Well, depression looks a little bit different in an older age group. Older adults tend to express their emotional pain more as physical symptoms, and we need to be on the lookout for that as well. Transforming our system doesn't just mean our healthcare system. It means the way our society is structured. A society that does not tolerate discrimination based on age or medical conditions. A society that's creative and innovative in the ways that it supports all the potentially vulnerable people that we've talked about tonight. The piece about individual stories is really important, and what works for one individual might not work for another. And I have a number of patients in my practice for whom medication has been a lifesaver, an absolute lifesaver. And other individuals that we've tried medication after medication, and literally sometimes it will be years down the road. The thing that made the difference is going out and buying a dog, that changed this person's life around. Picking up a musical instrument, like it could be anything and so unpredictable in any given individual. So I would just echo and advocate for try different things, talk to different people. There is a lot of good evidence for medication, for cognitive behavioral therapy as a type of psychotherapy, for pet therapy, music, mindfulness-based stress reduction. There are a lot of great options, yeah.
I want to share with you my story. I have been suffering from depression. My daughter is 25. So that was postpartum, but also I had post-traumatic stress. My little brother died when he was 3. And so what happened was I was hospitalized in every hospital in the city. I even went to HPH. I was there for about 3 months. So what I'm saying to everyone here is do not give up. I dug and dug. I was at the bottom, like you said. And today I'm here, and I had to have 9 ECTs. I almost lost my family because nobody understood. They said, well, you have everything, Rose. I did. But guess what? I didn't have happiness. I didn't have joy. I felt empty. And once I took all my pills, and thank God, I got saved. My husband got me therapy. My family became closer. So now I'm enjoying 4 beautiful children, 3 grandchildren, and I say, don't give up. And my doctor, he said to me, one day, Rose, I want to see you go up to that podium. And you know what? I feel this is the moment. So to me, this is, I'm like, wow. So thank you. You made me say this. So I admire you. And please, please don't give up.